I want to say good evening to everybody. I'm Keelan Pontrella. I'm the executive director with the Eastside Forum, and I just want to start by thanking everyone for joining us tonight for what's going to be a really fantastic discussion. Before we jump into this, I just want to note that everyone's currently on mute, and we ask if you want to participate or add questions to our conversation later down the line that you drop your questions into the chat, and please don't hop on the mic just so we can manage the space effectively. And then for those of you who are new to the forum, the Eastside Human Services Forum is a coalition of government partners and service providers, all who are working to strengthen the health and human services network on the East Side, specifically by trying to provide and create opportunities like this today, these intersectional spaces where we can have conversation and dialogue and learning. And with that, I'm going to hand it over to Garrett.
Yeah, hi, good evening, everyone. My name is Garrett Plesko-Moore. I use he, him pronouns, and I am on staff with the forum as well, too. I want to offer an additional thanks for everyone who's joining. This is a special evening event for the forum, expanding on our usual audience beyond those affiliated with service providers or local governments. So an extra welcome to everyone who's joining a forum event for the first time, or maybe first time in a while. As we all know, this is a very critical moment for reproductive health in East King County, all in Washington State and nationwide. Reproductive health care, like so many human services, has been significantly impacted by the pandemic. For example, maternal mortality rates spiked in 2021, and due to systemic racism, that rate was nearly 3 times higher for Black people nationally as well. Further, a lot has changed in abortion access, even since last summer's ruling on Supreme Court on Dobbs v. Jackson. Even just these last few days and weeks, the Supreme Court temporarily lifted the recent restriction on mifepristone, critical drug in abortion and miscarriage care. Governor Inslee purchased a 3-year supply of mifepristone, as the future of that drug remains unknown. And Washington State passed a number of bills, including a shield law for abortion providers, supporting folks from out of state who are seeking abortions here in Washington. So there's a lot for our incredible group of speakers tonight to discuss. I'm going to actually invite them to introduce themselves to you in just a moment. So Councilmember Perry, would you mind starting us off?
Absolutely. Thank you, Garrett. Appreciate it. I was born Sarah Perry Moore, so we must be cousins somewhere back in the recesses. I appreciate being here. I appreciate being part of the conversation in the most basic of human and civil rights that we have in front of us. And I am recently elected and am brand new. They call baby fresh person. Legislator. So I've been here now 1.25 years, and my district, so each of the King County council members, there are 9 King County council members, and we have 252,000 representatives in this last redistricting in each of our districts. So my district is from Issaquah, it goes from East Lake Sammamish to the Snoqualmie Pass, and from I-90 to Highway 2. So it's Issaquah, Sammamish, Redmond, Woodinville, Bothell, Duval, Carnation, Snoqualmie, North Bend, Falls City, Preston, as well as Skykomish and the Snoqualmie Pass. So it's 1,000 square miles of the 2,300 square miles of King County. And it's a very interesting cross section. It's the second most conservative. So I think Reagan Dunn's is the most conservative of the 9, and then ours is the second most. So it's an interesting rural urban space that we sit in, and ideas. And I get very colorful emails from some of the folks that live in the more rural space. I got one yesterday. And you know, it's a very important conversation. I raised our kids in the Valley. I live in Issaquah. My spouse is Representative Bill Ramos. So he is in the state house. Not everybody knows, because he wouldn't take my name when we got married, but it's, you know, very important public service in our household, and very important collective shared voice on this issue. And it's incumbent on us in these days to do everything that we can to use our leadership to make sure that everybody's rights are protected. I'm glad to be here.
Thank you, Councilmember. Rokea, would you introduce yourself next, please?
Hello, everyone. I think my screen is frozen. Am I right? Is it frozen?
We are
Yep.
not able to see you right now, yeah.
Oh no. Okay, I don't know what's going on, y'all. Technology is not my friend this evening. So my apologies. I would otherwise love to show my face. But without further ado, I'll just continue on. Hello, everybody. My name is Rokea Jones. My pronouns are she and her. I am a longtime birth worker, birth keeper. I've been working as a doula and educator for about, off and on with being on call, but staying with the work for about 16 years. I currently work for the Tubman Center for Health and Freedom as a community-based researcher there, and really my focus is in systemic change and equity and of course getting resources and education out to as many people as possible. So yeah, really happy to be here and speak more to that work. So thank you.
Thank you, Rokea. Sammy, can I pass it to you to introduce yourself?
Hi, everyone. Thank you so much for inviting me to participate in this vital conversation, Garrett. My name is Sammy Alloy. I use she and her pronouns, and I'm the Deputy Director of Pro-Choice Washington. Pro-Choice Washington is the only independent statewide advocacy organization in Washington whose sole role is to advocate for the protection and expansion of abortion rights and reproductive freedom. Of course, we work closely with our friends at Planned Parenthood, but they are also a direct service provider, and we are only in the advocacy space. Pro-Choice Washington is formerly known as NARAL Pro-Choice Washington, which may be a familiar name for some folks on the call. We became an independent state-based organization in 2021, and we work to protect and expand abortion access and the full range of reproductive justice and freedom options for Washingtonians and folks who need to access those services in Washington so that everyone can have what they need to thrive. I am new to the Washington space. I have worked in advocacy, legislative campaigns at the intersection of racial, economic, and gender justice in in Oregon for the last 20 years around issues around, countering the rise of white nationalism, economic justice, workers' rights, minimum wage issues, and of course, reproductive freedom. And I jumped into Washington about a little over a year ago, right before the SCOTUS leak around the upcoming Dobbs v. Jackson decision. And I'm just really grateful to the community in Washington for welcoming me and for the amazing work that I have been able to do in community with all of you to make sure that Washington is an abortion sanctuary state in these really important times. And I'm really looking forward to the conversation tonight.
Great, thank you, Sammy. Dr. Khattar, can we go to you, please?
Hi, my name is Anuj Khattar, is he, him pronouns. I am the current medical director at Cedar River Clinics, which is, I think, the largest independent abortion provider in Washington state. I am a family physician as well, and still serve in that capacity at different places. And it's been interesting to see how the recent legal changes has changed the landscape of service delivery, as well as just the increase of volume of patients coming from out of state. Prior to the decision of Dobbs last year, I was traveling out of state to Texas, Oklahoma, and Tennessee to provide abortion access. So I'm very familiar with the stories from the patients there, and it's so disheartening to see what's happening around the country right now.
Very well, thank you, Doctor. I am just before we switch gears and jump into questions, I want to give a heads up to folks that if you would like captions and you're not currently seeing them, you can access those by clicking or tapping on the More option, the three dots, and then language and speech. It should be under there. So without further ado, let's dive in. We have some questions that we've prepared in advance for the speakers before we open up to questions from the crowd. I'm going to be kicking off with one of these questions directed at each of the speakers as we go. But speakers, please feel free to jump in on any of the questions as you see fit as well. So with that, Councilmember Perry, this first one's going to start with you. What do you see as the greatest threats to abortion access in Washington, especially in East King County right now?
Thank you. I appreciate that. You know, because we have such an amazing governor and amazing attorney general working on our behalf, we're very lucky. And the proactive steps they've taken, which you've illustrated, are really, really important in this. The issues that we have with the county working very hard to block abortion still have implications. And so while we don't know what's going to happen with Christone and we have a stockpile, there is always the threat to losing everything federally because everything is unsettled. And so I'm a big believer in civic action. I've seen it happen, you know, the change happen over and over and over again. And I think sometimes people sit back and decide that, no, that's not going to happen. Like what happened in 2016, that's not going to happen. And then it happens and people are sort of stunned that that our rights could be taken away so severely. They're going to see that. And so I think the threat is very real still, that it could be federal, and we cannot let go of that. I feel like we are in a much better position, even decriminalizing behavior from others, other people being supportive of people coming here from other states. We're continuing to take steps to make sure people are supported and protected, but it's not done, and the threat is very real. And so I just think we have to be absolutely vigilant and be prepared for what happens if this does go forward. What do we need to do, and be ready to activate. Activation makes a huge difference. I mean, the biggest threat is the biggest threat. That's all I can say, because we've got the good guys working on our behalf. So, yeah.
Any of the other speakers like to comment about some of the greatest threats to abortion access right now?
Yeah, Garrett, I'll jump in. You know, I will absolutely agree with everything that the council member said, and also add that, you know, we have faced huge gaps in barriers to access since long before the SCOTUS decision last year. You know, we know that Roe v. Wade was never enough. It was the floor in access, not the ceiling. And even though, you know, I believe that we're lucky to live in Washington, we've also worked hard for generations to proactively, you know, get to where we are politically with our protections for abortion rights. And we need to continue to do that work. But we also have, you know, huge barriers in access within our own state, particularly for communities like Black, Indigenous, people of color communities, LGBTQIA+ communities, and low-income and rural communities. And in Washington, you know, unregulated hospital mergers and health system mergers and acquisitions are a major problem, because a lot of our, not only hospitals, but provider clinic networks are sort of being sucked up by conglomerate systems that have discriminatory denials to care because of their internal policies. And in rural communities, including in not just rural, but in King County, in East King County, and in rural communities, and all over the Olympic Peninsula, we have just the vast majority of providers in certain regions of our state that there is no abortion access because either there are no clinics, there are large travel times to clinics, and local providers are not able to provide those services because of their workplace policies. So, and of course, we know affordability continues to be a major issue, and it is only becoming more of an issue as we are welcoming so many patients from other states. We're seeing wait times for appointments getting longer, people having to travel longer distances, abortion funds being more spread thin. And for people who are underinsured or have high deductibles and high copays, they may have to find $500 to get an abortion in addition to having to pay for transit, hotel, childcare, taking time off of work, etc. And that's on top of the very protective and proactive policies that our state has on abortion care. So I think, we really need to continue to push forward on making our state truly ready to welcome out-of-state patients and be an abortion sanctuary state for everyone. Even though I think many people sort of go, whew, we're lucky to live in the Pacific Northwest. And a lot of constituents sort of think like we've checked that one off the list, and really we've only checked it off the list for certain people. And we need to make sure that this vital healthcare is available to everyone who needs it when they need it and where they live.
And can I jump in for a second, Garrett? Yeah, Sammy, thank you. That's great. I so agree with the point about the hospitals, Providence, the religious-based hospitals, and we're funding some of that. So we have to challenge that funding because as they eat this up, as they become these conglomerates and they take over what's happening with our insurance industry in our hospital and insurance and how they're in relationship with each other, but their religious-based focus and not allowing abortion. It's a very real and critical issue and threat. It's a very big threat to our state. And I think, Planned Parenthood moved out of Issaquah. I don't know what's going on our district. I don't know what's happening east of Bellevue. I need to find out more, so I should be in touch. But I also wanted to mention that Senator Murray has introduced legislation to provide women the support they need for access reproductive health services by providing grants to organizations, including abortion funds, to offset the cost of travel-related expenses in her role as in the Appropriations Committee. And they've also, a whole bunch of folks have come together to co-sponsor the Women's Health Protection Act of 2023. So our folks, our senators, are in very high leadership positions, which we're lucky to have as well. So not just what's going on with our governor and our attorney general, but we have our legislators fighting hard. Schreier, Murray, Cantwell, Del Bene, they're like a lock. And we have the ability to support them. But one thing they need from us is to hear from us. They're actually asking for us to write them, to hear from us, to give them the support they need, saying their constituents are calling on them. So showing that support also helps us in this case.
Not to rail the point of local politics, but I think local politics are very important since the decision of Dobbs happened last year, because it basically allowed a lot of freedom within each state to make decisions about this. But I also want people to understand that the Republican Party wants to federally ban abortion access, which we're seeing happen with mifepristone right now. And the Senate is hanging on a thread. The presidency, who knows? I feel like there's a very good chance that within 2 years, everything will look different nationally, and we may not even have states' rights. So please encourage your friends in other places to vote, make these networks, connect with people, and remind people how much power we have with our voice when we actually choose to do things that are good for our community.
Thank you all for your additions there. Shifting gears a little bit. So I think we've recognized previously, but diving in a bit more, systemic racism remains prevalent across our healthcare system. And this reduces access to quality care, as well as makes worse outcomes for BIPOC folks across our communities. And Dr. Khattar, I'd love to direct this one to you first, but welcome anybody to respond. What are some of the changes in service provisions in particular that you think would ensure greater equity in reproductive care?
Yeah, one of the big things I think that would help increase equity in care would be repealing the Hyde Amendment. I don't know how many people are familiar with the Hyde Amendment that was created when Roe versus Wade was initially passed, restricting federal funding to be used for any abortion access or care. And what that's done is tied a lot of federally qualified healthcare centers or community health clinics from being able to provide this essential healthcare access in all communities. And I think that really restricts where people have access to get the abortion care that they need. If we could figure out ways to support local communities in creating separate funding streams or repealing this amendment that shouldn't have been placed in the first place, I think we could figure out how to actually create increases in service provision around the state, country, in a lot of different places where abortion access wasn't accessible before, specifically for medication abortion care, which I think is personally medically very uncomplicated, and I think can be done by many people, nurse practitioners, physician's assistants, medical providers everywhere.
I can jump in. Oh, go ahead.
Oh, I was gonna say, if it's okay if I add to that. Apologize, y'all. I'm trying to also figure out tech on the back end. So sorry, still no camera, but I wanted to speak to that because I honestly feel like what's been the most impactful in terms of making sure that services are a match for community needs is really doing a landscape analysis and spending time engaging with community members, asking them what their needs are, where we need services, how they would like services offered. And so, I'll say personally, I was really surprised at how much there is a large Latinx or Latine population in the Bellevue area. And just when you think about in terms of when we start to build affordable housing, sometimes where there's land available means that we are moving a community of folks kind of out of the way of where there may otherwise be a bunch of services available. Right. And so we'll have new communities needing services based on where housing is. And so I think that, and the next layer to that, right, because we're talking about equity, is that we need to also consider how can we bring providers that are culturally congruent, and or at least have some ideal around what would be culturally appropriate care for the community that's showing up for services. And I think that that's missed when we talk about abortion care, because people are often in crisis when they come to abortion care, and have made up their mind that that's the care that they're choosing, but otherwise don't get a whole lot of information, right? And otherwise are, fortunately, if you have really great providers, you're getting care and information about what your options are for aftercare. But because the government is putting families or able-bodied folks, people with the capacity to birth, in this situation where they're needing to seek care in these desperate ways, we've opened up the door for people to consider underground services and other risky practices. And I hate to say risky, but for lack of a better term, we're missing, like, what does it look like to bring holistic care to this process and think about the full perinatal spectrum, even if it's abortion, right? We still need to think about what will that person need before, during, and after. And, to bring in social determinants of health, right? There may be some other circumstances in their life, right? Could be a number of circumstances that bring them to the place to where they feel abortion is the best option for them. But what else is happening within people's realm that they may need support with? And so I just really, want to continue to challenge us all to think about what is real holistic care, even around abortion care. How can we extract the desperation from that experience and really be able to show up for people? So those are the things that came to me.
I just want to make one comment, Rokea. From a medical perspective, I would probably not say risky. I would say maybe less informed, because self-managed abortion is very safe. And the majority of ways that people are accessing abortion care outside of the medical setting are with pills. And that didn't exist prior to Roe versus Wade. That's a relatively new scientific discovery. So it is much safer for people to seek care outside of the medical system. But it would be nice if patients didn't have to do that. So from a harm reduction standpoint, it would be nice if you could just walk into a clinic and ask for the care that you needed.
I absolutely appreciate that. And I wasn't specifically thinking of, using like the medications that are available and people can absolutely perform these services in the safety and comfort of their home. I was thinking more of places that could potentially crop up and say that they can perform the procedure. But I really appreciate that clarification. Thank you.
And I'll get a little bit wonky here. The two champions in our Washington state legislature on this front are Senator Karen Kaiser and Representative Jessica Bateman, both of whom introduced legislation, House Bill 1854 and Senate Bill 5768, authorizing the State Department of Corrections to distribute or sell the medication to licensed health providers across the state. That's huge. And then also House Bill 1469, sponsored by Rep. Hansen, provides legal protections for individuals who provide or receive protected healthcare services from lawsuits and criminal case commenced in other states. Protected healthcare services include reproductive healthcare and gender affirming treatment. The bill has passed both chambers and is waiting the governor's signature. And then sponsored by Rep. Slatter as House Bill 1155 at the request of Attorney General Ferguson, establishes consumer rights with regard to consumer health data that you were referring to, Garrett, and defines obligations of regulated entities that collect, process, share, and sell consumer health data, prohibits implementing a geofence to track or collect data from consumers who enter certain healthcare entities. It was amended by the Senate. It's back to the House for concurrence. And she's a data diva. I mean, that is what Rep. Slatter does. So that's really great. And then Senate Bill 5242, sponsored by Senator Cleveland, essentially recognizes they don't want to impose cost sharing. So it's a health plan, including student health plans that provide coverage for maternity care services, also has to provide coverage to permit abortion. And the plan may not limit a person's access to services related to abortion of pregnancy, except for generally applicable terms and conditions, including cost sharing. So a health plan is now not required to cover abortions that would be illegal under state law. The bill essentially prohibits health plans from imposing that cost sharing. So it's, again, a protection, and it is awaiting the governor's, it's passed both chambers and is awaiting the governor's signature. So we have some really amazing work happening in the House and the Senate, and it's exciting.
Absolutely. Thank you, Councilmember, for highlighting those. And actually, this is a perfect segue. Sammy, I'd love to direct this one to you, especially from that advocacy lens of Pro-Choice Washington. Are there additional changes to local and state policy, either that you're really proud that Pro-Choice Washington fought for and won, or that you see there's still work to be done?
Yeah, thanks so much for the question, Garrett, and thank you for uplifting those, Councilmember. Those are some of the bills that Pro-Choice Washington also worked on, so I'm glad to hear them spoken about here. Rokea, it's nice to see you. We can see you. Before I jump into state level bills, I wanted to sort of pile on some of the questions about East King County and locally, I wanted to uplift that, to my knowledge, and things, are always changing, but the only abortion providers in King County that aren't in Seattle is Planned Parenthood in Bellevue, a Cedar River Clinics in Renton, and a Planned Parenthood in Federal Way. So, when we think about how much abortion access people in King County have, it's not as local to where people live as we think, unless you're lucky to live in one of those places. And because of the hospital merger issue that I mentioned earlier and the sort of delays to care issue, we heard a story from one person who had to terminate a wanted pregnancy in her second trimester, and she had a really hard time finding a provider who could do it, and she was sort of just ejected from her hospital because they wouldn't provide it. The referral that they gave her was for a provider that was not in network, so hopefully the cost sharing bill will help with that kind of issue. But she basically just had to go in the middle of losing her wanted baby and spend several days on the phone, like calling through clinics until she could find an appointment in Renton, and that pushed her into a window in her gestation that made her procedure more complicated and more costly for her and her family. And so these delays in being able to get people clinic access really has real-time consequences for people. And I will also mention that one thing that I would really love to see county and municipal level governments that have health departments locally do is take on a public health education campaign around the risk of crisis pregnancy centers. Because in places where we do not have enough clinic access, people are Googling, where can I find an abortion near me? And they might see a Google hit come up that says, oh, free pregnancy test, free ultrasound. And, they lure people in the door by thinking that they're going to be able to get some reproductive healthcare options. These places are not real clinics. They are propaganda centers to deceive and delay patients in accessing care. And if you give them your personal information and, any medical details, they don't have to abide by HIPAA. So they can sell your data to data brokers or to law enforcement and states hostile to abortion, or to anti-abortion groups that harass you. So these centers are a really big risk. They tend to crop up around places where there are a lot of youth, college campuses, and across the street from real abortion providers. And it's very difficult to stop these clinics from doing what they're doing, because they sort of say, well, we have the right to tell people anything we want. And, in King County, we have forced crisis pregnancy centers to label that they are not real healthcare providers, which is not the case elsewhere in the state. So we've taken one critical step, but we also really need to educate patients on how to find real clinics and care. And then on the state level, we had a really good legislative session by and large for abortion and gender affirming care and reproductive freedom overall. We passed the cost sharing bill yesterday. We passed the data privacy bill that was at the request of the Attorney General Bob Ferguson, that protects people's personal health data from entities like crisis pregnancy centers and also entities like instant messaging on apps that might share your personal health data that you thought you were sharing in private with a friend or family member with data brokers or outside entities. We also passed a SHIELD law to protect patients and providers information from being shared by public agencies in Washington with hostile investigations coming from other states, and a provider licensing protection bill that, you know, many providers are licensed in multiple states, like Anuj, who was doing the generous service of traveling to other states to provide abortion, and are part of an interstate medical licensure compact. So things like disciplinary action that could happen, or being rendered ineligible for the kind of critical insurances, malpractice insurance, et cetera, that providers need to be able to function. Those are tools that hostile states are using to take the ability to practice away from providers, even in states where abortion is legal. And so here in Washington, we've worked to pass a bill that is headed to the governor's desk that would sort of just instantly overturn that disciplinary action coming from other states and restore provider licenses. So, you know, we're really, really grateful to our legislative champions, and I want to really shout out Senator Emily Randall from the Kitsap Peninsula, and Senator Makadingra, and many, many others who worked so hard on these bills. But, you know, the one thing that I think we really left on the table that I keep mentioning is this hospital and health system mergers issue. The Keep Our Care Act is a bill that has come forward the last couple of sessions. It was Pro-Choice Washington's #1 priority this session, because these hospital and health system mergers not only can restrict abortion, but all sorts of controversial healthcare procedures, essential healthcare like medical aid in dying or trans healthcare, gender affirming care. We really need to act quickly in Washington because these mergers are happening very rapidly. We now have over 50% of hospital beds in the state of Washington are within provider networks that are operated by systems with discriminatory denials to care. You know, the more and more these mergers go forward, the more beds that we lose that are that don't have these restrictions. And so what the Keep Our Care Act would do would be to give the Attorney General's office oversight and enforcement power to ensure that any proposed mergers and acquisitions would expand patient access to care rather than harm it. They would do an equity assessment to make sure that vulnerable and historically excluded communities would not be disproportionately harmed by the proposed merger, and they would enforce the provisions to make sure that that patients are able to access care at their local hospital. So this is a really important bill that's going to, the Keep Our Care Act. This is a really important bill that's we're going to continue to see in future legislative sessions. And even though the session is almost over, people can take action to let their legislator know that this is something that they would really like to see come forward in the short session, and why it's important to you.
And Sammy, who sponsored that? Is Nicole Macri involved in any of this because of her chops with healthcare and as an LGBTQ community member?
Yes, she is involved. It was chief sponsored by Senator Randall on the Senate side and Representative Simmons on the House side. The Senate bill ended up being the vehicle, and we're really excited that the bill went further than it ever has before. Last year, it didn't make it out of committee. This year, it almost made it to the Senate floor, and we just saw hundreds and hundreds of people signing in pro, coming into the Capitol to testify, and a lot of really exciting media coverage that I think people are starting to understand this extremely dry legalese issue that is hard to make accessible for the first time, because if it impacts you, you understand what it is, right? So this is something that I think we're really building a lot of momentum around. And even though we didn't make it this year because the power of the Washington State Hospital Association lobby it's just a very powerful and well-moneyed lobby. And that's something that we really need to overcome, that opposition and doubts that the opposition is sowing with legislators. But I believe that we can do it because so many constituents and patients are impacted by this issue, but we need you to speak up to make it happen.
Great. I have something to add when there's a moment to.
Yeah, can I just piggyback onto something Sammy said about the crisis pregnancy centers? There is nothing that makes my blood boil more than a patient who has been fooled into seeing somebody at those clinics before coming to the clinic where they actually need to seek care. They are told so many lies. They believe so many wrong things about what is going to happen to them, what they're going to be going through. And the ultrasounds that they're given are often fake. They're lied to about how far along they are in the pregnancy to prevent them from seeking care when they think when they think they're supposed to be seeking care. So yeah, I've just had numerous encounters with patients who have unfortunately been seen at crisis pregnancy centers before actually making it to a real health clinic. And I wish there was a way to hold them accountable, but because they are not actually medical clinics, there are no rules or regulations they're required to follow, and it's quite frustrating. And I don't know why our country funds them, but that is something that happened.
Well, in King County, as Sammy mentioned, King County passed legislation prohibiting misinformation, and they have to actually post that they do not perform abortions. They have to post that. That's just a King County thing.
Yeah,
and
the country, right? Like, it's
no, it's repugnant, and my predecessor was the lone no vote on making that clarification. So who you elect matters. It matters. It matters because they become our senators in the U.S. and they determine these. They become our senators and representatives in the state if they were, started out as school board members or city council members or just walked on like I did, right? So I didn't walk. I worked really hard and I won, but I did not have prior legislative experience. But it's really, really important who we just getting in there and doing that work. One of the things about the East Side for our cities and providers, we have to emphasize access to rural areas, and especially in culturally and linguistically and religiously affirming ways. Like, our Sammamish, this wonderful squirrely city of Sammamish that we have here, 67,000 residents, 37% are born outside of this country. We have a very large Muslim and Hindu and secular Indian and African community. We have a Hmong community from the Vietnam War settling that brought lots and lots of families out here, a lot of Chinese speaking, a lot of Spanish speaking in the Valley. And we need to find ways to be culturally appropriate, and who we reach out to, and who are the leaders, not overt leaders, but the covert leaders in each of these communities, and how can we connect with them to make sure that we are giving them resources, them the access, so that they can share that with their community members, because it's there are different communities and cultures handle this differently, and there need to be avenues and resources, and we need to make sure that we're getting this in translated languages and culturally appropriate changes, as well as for our Snoqualmie tribe, our Muckleshoot tribe, our Tulalip tribe here. And we do have, King County Public Health Department currently offers resources for those in need of reproductive care access, including birth control, sexual health clinics across King County. Everybody's welcome, regardless of age, race, ethnicity, gender identity, sexual orientation, ability to pay, immigration status. And I have, Osman, can you pop that link in to chat so that folks have it? So King County Public Health doesn't provide abortions. The free or low cost clinics are critical, and we are committed to that. But it is very, very important who we elect. And I think one of my colleagues is recommending the first trans woman to the Women's Commission, and just really finding ways to make voices heard.
Well, thank you all for that incredible conversation there deeply on. I just want to double check, Rokea. I know you were having a little bit of issues with your microphone. Is there anything that you'd like to add from anything that's been discussed in the last 10 minutes or so of tech issues?
Can you hear me now?
There's a bit of feedback, so let's. I think we'll come back to you in just a moment. So I'll turn back to the rest of the speakers for now and ask. There's in addition to abortion access and increasing abortion access and diversifying abortion access and more, what are the other ways that you see that we can ensure that there is improved reproductive health care to folks, especially in East King County?
Dr. Khattar.
That's a great question. I don't generally work in East King County, so I don't know if I can be very local to that. I think, as I mentioned before, figuring out ways to incorporate abortion access into your health systems would be wonderful. I think it would help alleviate a lot of the stress and pressure on abortion clinics to do this on their own. It's been wonderful to see virtual telemedicine clinics open up and serve the needs of the community. Investing in those organizations could be helpful. I think access to contraception, one of the wonderful things about Washington State is our Medicaid covers contraception for everybody. And I think one thing that patients don't know, and I think we're trying to do a better job of this, is if you are pregnant, you qualify for Medicaid. If you end the pregnancy, you still have Medicaid for a year. So people generally forget that they have that access to healthcare to get their healthcare needs met in that time frame. And that's whether or not the pregnancy ends because of an abortion or because it delivers and they have a new child in their life. But that healthcare doesn't go away for a year after that pregnancy ends. So how can we, improve people's access to getting their colon cancer screenings, or, depending on medical history, or their cervical cancer screenings, or their other healthcare needs met in that time frame? So I think a lot of this will have to do with public health messaging and what we choose to share with the public, and how information is disseminated.
And I think we need to really look at the intention to crack down on books in our schools and access to information in our schools. And Riverview School District just tried to get rid of a bunch of books that reference LGBTQ. And we need to be vigilant with our library system. King County Library could do more with that kind of access and information, could be very specific about that. But we need to really pay attention to what's happening in our schools and find avenues through media, through different, I in my campaign, I sent emails to people my age and older, and I sent text messages and then I'd send emails to younger people. They wouldn't look at it. And if I sent text messages to people much older than me, it annoyed them, or they felt like their privacy was being invaded. Or if I called people, younger than me, they're like, what? Hello? So really thinking about the mode of how people want to be communicated with, and finding people in the different age groups to call folks, maybe do phone campaigns, maybe just reach out in a way that is systematic, is quarterly, is available, so that we're talking to people in the way and from the age group, and maybe from the cultural background, ethnic background that they are most connected to, most comfortable with. That with our crisis connections, we've got a teen line now. We have a Native American line. We have an LGBTQ line, and you have people on the other end that are listening to the voices from that lived experience. So I really think we just need to do more on the ground.
And I think part of doing more on the ground is also reducing stigma and fear. So I'm glad you guys whoever's at this meeting. I'm glad you're here, but I also want you to feel comfortable talking about abortion in the community. I think a lot of these bans on books are out of fear and like not wanting to expose their kids to things that they don't think are appropriate. But where is that fear coming from? And I think analyzing, moving forward with love and acceptance and harm reduction and understanding that human beings are human and we need to serve them in all capacities.
I'm so glad that you mentioned that, Anuj, because Pro-Choice Washington, as you probably know because you're on our board, we came out with a How to Talk About Abortion resource guide last year. That is a conversation guide for people to have conversations with their friends and family to destigmatize and normalize having medically accurate conversations about abortion. And it came out just coincidentally the same time as the leaked Alito draft SCOTUS decision. And I felt like it was so powerful to be able to give people a really accessible tool that they could use to talk to their coworkers and friends and family members about abortion. And really, for decades, the anti-abortion movement has framed the terms of the debate. The terms pro-choice and pro-life come from them, right? They're not, I think, actually controlling whether and when you decide to have a baby is the most life-affirming choice that anyone can make. And our movement is about love and life affirmation, right? So I would love to make that resource available to everyone. It's for free on our website, prochoicewashington.org. And I'm sure we can send it out with the notes. Also, sort of in regards to the question about what we can do beyond expanding abortion access, we try to look at reproductive freedom through an intersectional lens and look at also issues that impact the livability and access to services that people have, including police violence and affordability. And so we are part of the Washington Coalition for Police Accountability. They had a lot of bills this year that didn't move forward the way they wanted them to. And we also are part of the Balance Our Tax Code Coalition. Washington has the most upside down tax code in the country. And it's a constant problem when we're talking about funding for public services like reproductive health care, when we are not taxing the very wealthiest people in our society appropriately to give everyone the things that they need to thrive. So we need to continue to work on revenue reform and just sort of basic human needs. And I know, Garrett, that you wanted to talk about reproductive justice, and I think that those steps are steps that we can sort of take to get us there, but I'm jumping ahead.
Sammy, you're giving me great segues tonight. Thank you. Our last of the prep questions, and then I promise we will jump into questions coming in from the audience. Please feel free to continue adding those to the chat or the Q&A section, and thanks to those who already have. And Rokea, gonna invite you to jump in on this question first, as long as your mic is working and available, and then invite others to join as well too. So the nonprofit Sister Song defines reproductive justice as the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. And so I want to ask, what does reproductive justice in Washington look like to you? And Rokea, is that microphone working now? All right.
She looks frozen.
I will open it up.
Frozen. Yeah.
I will open it up to others on the panel as well too, if you want to jump in on that question.
We need the full sovereignty of our bodies. We need the inalienable right of our control over our bodies. And those most impacted are those who aren't paid a family wage, who are most vulnerable with violence, who are most vulnerable with income, with access. The way the this same kind of work, getting people in office. I keep thinking of my like daily hero. I have different heroes, and today it's Representative Jamila Taylor, and doing reparations work. I mean, it just flew through. Who knew? And she put it forward and did it, right? And so we need people who understand with lived experience that lots of people trying to do good work, but unless you get it, unless you have the lived experience in that space, the danger is you're going to use up all the political capital. Like maybe some of the stuff didn't get through with the hospital thing because you were using all the political capital over here this time, and that's enough, thank you. And you go back at it next time, right? But we need to not use our political capital in ways that don't actually make a difference. And sometimes it's tiny little levers like drop the box, and it makes a monumental change in an entire culture. And if we can get smart enough to just move those levers, really focusing on the people that have the absolute least access. What does it take to do that? But not be the people who got the most access doing it. Find those who experience at least access to bring that forward and have that voice and influence. Manka Dhingra does a beautiful job of bringing the constituent voice in all the time. So, I think that part is super important. To really have that conversation around lived experience when building that legislation, and that brings that justice forward.
Rokea, is your computer working now?
You're not frozen, but your sound is off. No.
I'm sorry about that, Rokea. I'm going to keep working with you on the back end. Maybe we can get help with a call in instead. Were
I
there
was
any
going
other?
to say just quickly, it might be that you need to call in because I think I accidentally terminated your other duplicate thinking that was causing the echo. So yeah, call back in.
Would any other speakers like to speak to this question around reproductive justice?
I think it's tricky for me because so much of this is intersectional. Like, how are we creating a place for people to want to live, to be excited to live in, to be safe to live in? Like, how are we creating communities that are trusting each other and want to be around each other? I think there's so much we can do from a policy standpoint to do those things. But I'm not a policy expert, so who am I to say? But how do we become an enviable place to live where we have opportunities for people to thrive and just be human? I don't know. I'm a big proponent of universal basic income. I feel like that would help people just exist. And I think to exist and have freedom in existing, you can have reproductive justice, right? Like, you could just be paid to have a family. How cool would that be? So I don't know. There's so much for me that mixes in with this. It's hard for me to say reproductive justice is just one thing. But yeah, I feel like people should have autonomy over their bodies and the decisions to have families when they're ready to, and to have the best families for them when they're ready to. And I hope one day we can get there.
Thank you.
Absolutely.
So
Sorry,
Sandy.
I absolutely co-sign that, and I think just want to reiterate that something that Dr. Khattar said earlier, which is really that the anti-abortion and anti-LGBTQIA movement will stop at nothing to strip us of our rights and our humanity, and many populations in this country have been struggling with that dehumanization already since 1619, and that dehumanization and that stripping away of bodily autonomy really harms us all. And I think you said it so beautifully, Anuj, that just letting people exist, letting people, regardless of your gender identity and your race or income level or what have you, really exist with the full spectrum of being able to make the decisions and have agency over your life and the things that you need to thrive. Because I think I've really seen where this anti-trans and anti-abortion movement has been stripping away access to basic essential reproductive health care, has made it so complicated to even access the basics. You know, I am a queer woman who is married to a trans person. We both have uteruses and we have a baby, but we had to access a lot of services to get pregnant with the baby. And, you know, it's like just being able to get screenings and blood work and culturally competent care and a doula and all of that stuff that people need for, you know, the full perinatal spectrum that Rokea was mentioning has become so challenging in our society because of the hostility towards reproductive freedom and gender diversity. And, you know, obviously race, right from the very beginning of our country. So I think we really, really need to work together and build a broad-based movement that doesn't leave people behind, and really work together to realize how many people's identities are being threatened by the actions that are being taken right now. And I also want to call back to something that Councilmember Perry said earlier about the importance of local elections, because 2023 is a local election year, and so many voters sort of like check out and think like, oh, I don't have to care about elections this year, like, whew. But, you know, these community organizing opportunities around these local elections and the opportunity to build leaders and elect grassroots powered representative democracy candidates that from our communities is something that we just absolutely cannot be sleeping on. And it's more important now than ever when our communities are welcoming people from so many other states to receive care here. So I just want to call that out. Like, get ready for summer and fall, because advocacy organizations are going to be calling you to contact voters. And I know it feels a little icky to call people that you don't know and talk to them about voting, but it's really not that hard, and it makes a huge, huge, huge difference.
Yeah, call me. I'm happy to talk you through it. It's an awesome thing. And actually, you know, sometimes people tell me I don't mean to put anyone down here. That's not my intention, but I get tired of people telling me how tired they are. You know, I worked hard, check, I did that. I'm so tired. I'm going to take a break now. And I just think I got nothing for that, because we have to do self-care. It's very important. But if you think about it, not in terms of these big splashes of time, but you think about your own world and your own social justice work, incorporating a certain amount of time every week for whatever that looks like for you will protect you from all of these things coming up. You know, deciding, like I decide I do a certain amount of social justice work in my day. That's just what I do. And if I can't do it in the day, I do it in the week. And I just make that space for it. What I do changes, but I have an amount of time that I allocate to it. And I have it as part of who I am intrinsically because of what matters to me. I want to not just be really busy. I want to make sure I'm doing self-care, but that justice work is a really important part of that. So I don't have that ebb and flow. I just do the thing. Well, unless I'm in a campaign, but I just do the thing, right? And so I encourage us to think about that, because this is not a splash. This is a lifelong endeavor. This is a playing the long game, because you know they're playing the long game. They're thinking, who's 3 cycles of school board down? And who's 3 cycles of city council down? And how can we get our people there so we can get our agenda through? And to your point, Sammy, about holding the narrative, we got to hold the narrative. Sister Joan Chittister loved this woman. She told this whole room of Republicans, you are not pro-life, you are pro-birth. Because if you were pro-life, you would be supporting that baby after that baby was born, and you do not. Love that woman. Holding the righteousness of what's actually going on and holding the language of that, the justice of that is really important in that narrative, and finding ways to, as you were saying, Garrett, just being out there and talking about it and holding that in spaces where somebody just needs to hear that. And finally, that the work that you do, Rokea, I can't hear your voice. I'm very sad about that, but I so respect the birthers, the communities, the ones that hold the people in those spaces. We have birth doulas. We have death doulas now, right? We should have doulas for abortion care. We should have people in our community who are the wise people that people go to just talk, not that will be there and protect them and support them. And they have training on how to do that. And they're not providing the abortion, but they are holding those people in love in that space and support. We don't have that. It's a very alienating, isolating experience in the way that we hold this in society right now. And I think we could do better in that as well.
Beautiful. Thank you. I want to transition us now to some questions from the crowd. We have Councilmember Di Michelle, also a board member of the forum, who's asking, it appears that anti-abortion advocates are creating more and more radical and punitive proposals. Is their next step reducing access to contraceptives? Do you have an assessment of their ultimate goals in the multi-decade campaign? Please, anyone who would like to jump in.
Yes, they are introducing proposals already to ban contraception in the U.S. And there was a bill in the U.S. Republican-led House of Representatives that did get a majority of votes. Luckily, it didn't, go all the way, but I think it's very worrisome. And when I say they will stop at nothing, I'm not being hyperbolic. There's a concerted decades-long campaign to strip people of their bodily autonomy and reproductive rights. And, it has worked very closely with the sort of white nationalist coalition to sort of systematically chip away rights from people of color, queer communities, and women. And I think we can see their plan was pretty much laid out in the Alito draft. And it's just right there for us all to see, because they are not, even hiding it anymore. We know that they're coming for trans youth, gender affirming care, and drag, and they plan on coming for gay marriage. We know that already 25% of trans youth live in states that have bans on gender affirming care for minors, and another 25% of trans youth live in states where those bans have been introduced, including here in Washington, where luckily they're not going to pass because of who's in the majority in our legislature. But this is the political reality. We know that already here in Washington, we've seen bans on contraceptive care introduced that we have to monitor and put down every year. And, and that's why elections are so important. So yeah, it's shocking, and it can be disheartening at times to see that we're having to fight for the same things over and over and over. And I can't imagine for people who were part of the generation who fought for Roe v. Wade in 1973 that we're back here now. But I think we have to just continue to monitor, to make people in our communities understand why elections matter, that, the candidates are not the same. And, also, public funding for services and sort of stabilizing our communities are so important, because when people feel destabilized and they don't have access to their basic needs, that's where, we have, we're vulnerable to electing people that will allow these kinds of really sort of radical anti-democratic movement proposals to go forward.
Just highlighting for a moment, Rokea, thanks for your contribution in the chat as well. She's, I believe, replying to an earlier question that there are doula that we have doula trained in what is called full spectrum doulas. They provide birth, postpartum, and abortion care as well. So I think to touch on just a moment ago. Continuing on, and added then a moment ago, we need to continue to support and empower community health workers, have stand in the gaps and have been successful advocates and system navigators. Thank you, Rokea, for your additions there. So next up was a question from Rachel Alger. Has there been a reason given publicly on why the Keep Our Care Act bill keeps stalling?
Well, I think that the reason is that our opposition is very powerful. They have a very well-moneyed lobby. They have an army of corporate lobbyists, not only from the hospital association itself, but from each individual institution that has lobbyists. And they sow a lot of doubt in legislators' minds. And even our Democratic legislators who we appreciate and partner well with on other issues have had doubts. And some of the misinformation that is happening around the Keep Our Care Act, the Hospital Association and the hospital lobbyists sort of say like, oh, if we have too much regulation and red tape, it'll make everything so costly. We'll have to shut down and hospitals will close and then people will have less access, which is just a narrative that we've heard on literally every issue, like every regulation and social justice law, from the beginning of time. And so what we really need is more direct service providers, more doctors and their professional associations, and more just general constituents and patients to contact their legislators and speak up about this issue. Because when you do that and when you write letters to the editor and you make your voice heard in public, it gives legislators political cover. If they want to support you and they know that a powerful, well-moneyed opponent is going to be really angry with them, they need to know that we have their backs, and that the voters really are going to appreciate them for this issue. And so, and we need to take that stand publicly. So that's, I don't want to sit here and drag, throw individual legislators under the bus, because really I think it's a caucus-wide issue of like, if the political will was there, that legislators weren't hearing these doubts and fears, and they were hearing from enough people, and we were doing enough organizing work to drown out the opposition, then it would grease and we would move forward.
And Sammy, if somebody wanted to contact you about how to write a letter and what to say and what testifying remotely looks like, would you be available to share that with people that aren't familiar with that?
Absolutely. We have a letter to the editor toolkit and template, and we have all sorts of tools. And we have an advocacy week at the beginning of each legislative session that is a hybrid, remote, and in person, where we train you on what it means to go to a hearing, talk to your legislator, go to a lobby visit, give testimony, and trying to make that process as accessible as we possibly can, because it is daunting. But when you do it, it's not that hard and it's very empowering.
Yeah, I can't overstate enough how important it is to show up. And if you can show up during legislative session and just be there for numbers and to show support for bills that are being tried, like we're trying to pass, I think that makes a big difference and influence. And the anti-choice people are very good at doing that. So I think it's important for us to be present and be there and show support, even though a lot of times it feels like a given in a state like ours.
So additionally, oh, sorry, Councilmember, would you like to add in?
Oh, I just I keep testifying. People keep calling me to testify about all kinds of things: senior tax exemption, Inspire Washington, 988. So I did a lot of testifying. Just, I believe in stuff, and it's super easy. They have had a ridiculous increase in participation by constituents because of the availability of testifying online. It is so very easy. Sometimes you have to wait a lot longer, so you do your laundry or whatever you're doing, but it really is a very powerful way to make your values heard, and they appreciate that. So I do encourage it.
Thank you. There's a question in the chat that I'm going to tack on to an earlier question that came up around what specifically does it look like to challenge crisis pregnancy centers, especially at the county levels? I know that's something, Sammy, you had mentioned, and I want to just also read off from Janice Zahn. What are the policies or support that city councils can do to advance this work?
This is something that I would really like to work in partnership with electeds and policymakers to come up with creative solutions on, because it is a tricky one. You may remember the Hobby Lobby case where, the sort of, religious exemptions and rights of institutions to practice their free speech and et cetera. I think that those First Amendment concerns really make it tricky to regulate CPCs and hold them accountable, because they are, really just groups that are telling people what they want to tell people, and they're not medical providers, so they're not subject to the same regulations. What we can do is similar, what we've already done is a great first step in King County, which is to make them disclose that they're not real healthcare providers. We need to make sure that they're not receiving any public funding. I think that I think the data privacy bill that we passed is a good step in terms of protecting people's data from them. But I think that we need to go further and really think about what is legally within our toolbox to label them even more clearly. Maybe there needs to be like a safe Google search or Google search optimization. There needs to be like public health campaign. I'd like to see billboards and bus wraps funded so that people know what crisis pregnancy centers are and how dangerous they are. And I think this is just something that we really need to do, like a massive public health education campaign, and think about, maybe using the power of our agency's auditors to make sure that no dollars are going to funding these entities, even if they're sort of happening through their umbrella organizations or churches or whatever the case may be. So I think we need like a multi-sectoral creative approach to holding these entities accountable. Any other ideas on the panel?
I think that funding is really, that funding point is really important. We have councilmatic grants, and we just give this money away, and we set our own rules essentially. And so I thought, well, I don't feel comfortable giving money away that we receive from public to those that are discriminatory on those basic rights that we affirm. But there's no check, and there's no look at that. There's no, Union Gospel Mission won't support the LGBTQ community, but they support everything else. I mean, there's no like awareness of that. You have to really look into those spaces to find out. But I think it's very important for those of us that have access to public dollars, whether it's councilmatic grants or it's also internal grants that are coming from the wide recesses of King County or the cities, that it is incumbent on us as leaders, and we take that leadership seriously, take the responsibility seriously to make sure that, and you can pass ordinances, Janice, to your point, you can pass ordinances about that because we support this or the other thing, we as a council body commit to not supporting organizations with public dollars that don't uphold our values in these areas, X, Y, and Z. So you can tie that to money. And I hate to say this, but to me, it really does come down to the almighty dollar. So if we can find ways to breathe life into those organizations that are doing the good stuff and take that oxygen in the form of money away from those that aren't supporting all of the people in the way that we need to see all of our folks supported. I think that's a really good move as leaders as well. But I would just sort of writ large question is, instead of reinventing the wheel all the time, who's doing the best work out there? Nationally, statewide, internationally, who's doing the best work? And where are we shy of that? We're looking at that with our gun lobbies. Where are we shy of that? That's what's moving us forward in these different areas. So can we look at who's doing really, really good work in these areas and say, hey, can we do that in King County? Can we do that in Bellevue? You know, let's see which state really, or which city really has it going on. Get a hold of their legislation.
On that note, I really want to uplift that in Washington, I keep doing the state confusion, in Oregon, we have done, my home state of Oregon has done something called the Reproductive Health Equity Act, which was a package of bills that did some things that Washington has also done around making sure that all insurance providers cover the full range of abortion, maternity, postpartum care, et cetera, and then follow that up by creating a reproductive health equity fund. And so our state's health authority allocated $17 million to a fund that they are partnering with a local social justice, Indigenous women-led charitable foundation to administer grants to predominantly to Black and Indigenous community care providers, including full spectrum doulas. Dr. Khattar mentioned the Hyde Amendment and the problem with federal dollars. This is a huge problem for Indian Health Services and anyone who lives on a reservation and accesses their healthcare through the BIA. So, really funding community-based, culturally specific providers is a step that I would love to see us take here in Washington through partnering with funders that are integrated into and in relationship with those culturally specific communities.
Wonderful. Just going to share out a few comments from Rokea as well. For her, reproductive justice in Washington state looks like a reduction in barriers to education so that we can get more diverse populations in health professions, so we can increase access to care and sustained commitment to look at social determinants of health. Further on the last question, I currently work for the Tubman Center for Health and Freedom and New Community Clinic, currently fundraising for capital funds. This is an organization dedicated to the care of marginalized communities and would absolutely provide abortion care. Thank you, Rokea, for uplifting both of those and both that incredible work. So thank you so much.
I would wonder, to that point, Garrett, Rokea, you're reminding me of a tour that I had in the crisis care center, and there was a woman there, African-American woman, who made it very clear that we're talking about making sure that we have people who are on the other end of the crisis call that look like the people calling. And she said, if you're talking about the Black and Brown community, there's no education funding for people to come into the behavioral health conversation that represent. And so it just reminds me of this, the wealth transfer and the work that Jamil is doing to make sure that if you were discriminated against by the redlining that Seattle did, or your folks were, that you get a down payment in a house. I mean, this is just like that, right? And so can we look at education and provide more support for education for people of color as part of the work that Jamil is doing, as part of the work that the state is doing to work in this field in particular? And so I don't know. I mean, I don't know what that looks like. It just seems like that could have some momentum and some steam to it.
Rokea adds, we have a consistent nurse shortage, but we have to take a huge amount of pre-work to get to a nurse program when nurses used to be accredited with training. We are coming up to time, and so I'm going to offer the speakers a brief 30 seconds, please, of closing remarks. We're going to go in reverse order from the opening. Rokea, feel free to add any final comments into the chat. And so, Dr. Khattar, if you would mind starting us off with anything else you'd like to share, whether related directly to the conversation earlier about your work, anything else there.
Thank you for being here. I think being here is a big step in regards to ensuring reproductive freedom and justice in the community. Like I said before, be open-minded. If you feel like you're having a negative reaction to something when people are advocating for themselves, ask yourself why, and ponder over it and talk to your community and figure out what's really right for everybody. Yeah, and I think that's all I have to say.
Sammy.
I'm so grateful for the conversation. Rokea, I wish that you could have been a bigger part of it. I want to like have a side chat with you. Yeah, I think I just want to leave folks with the message to stay engaged. You know, abortion rights advocacy organizations are seeing like a dip in interest because last year was a big year with the SCOTUS decision, and then people sort of move on and get tired. And this is an issue that's going to be an issue for the next generation or more, and it's right now only getting more serious. And so we really need you to get involved, and it only takes a few minutes to sign up for action alerts, and contacting your legislator only takes 5 minutes. And so join us. We need you no matter where you're at, whatever you can give, we're happy to have you with us.
Thank you, Sammy. Really brief comment before Councilmember you join in. We will be sharing out information and a recording from tonight's event. Hoping to include a few other notes following up from what Rokea is sharing here. Perfect timing. Final remarks from Rokea. We have a largely conservative state. Go home and talk to your family. Hold these discussions in your home. Start with those narratives that get passed around at home and in our communities, and spread the word. Educate and empower. Thank you, Rokea. And Councilmember Perry, please close us up.
Vote. Vote, run for office. If you aren't running for office, support somebody who does run for office. Vote and get 3 friends to vote. There's opportunities coming up very soon.
Thank you, Councilmember. And Caitlin, I am going to pass it back to you to close us out.
Great. Well, I just want to say thank you again to all of our speakers in this fantastic conversation tonight. I want to just highlight, as we go into the next few months, the forum has an event next month that we're going to be partnering with the Alliance of Eastside Agencies on to debrief the legislative session and set the foundation for education work over the next 18 months. So I encourage anyone with any of our service providers to join that activity, look on our website for information, and then we'll be taking our summer hiatus and picking up with education events again in September through the end of the year. Otherwise, thank you everyone for joining us, and I'm happy to call our session to a close.